I'm Dr. Lisa Kaufmann, Medical Director of the Adult Inpatient Physicians Group here at Watauga Medical Center. Our community is experiencing a healthcare crisis affecting our families and neighbors. We can choose which news and social media we follow, and our natural human tendency is to look at news that fits what we already decided back in early 2020, when we did not know much about COVID and everything about the vaccines was unknown. One way to balance that is to look at what is happening right here in the high country, happening to our friends and neighbors. While most people who get COVID will recover, some become seriously ill and some die. To make a wise decision, people need to know what it is like for people who do get severe COVID. We cannot bring you into these units because we have to respect the privacy of our patients. Those of us who work in the COVID units, doing our best to help people suffering with COVID, are here to share with you what some of the things are like for our patients, and before we go into work today to keep taking care of them. The few vaccinated patients we see admitted with COVID are typically people who already have severe chronic illness, and most of the time these are people that we have admitted in the past for their underlying diseases. Unvaccinated people we have admitted are often pretty healthy before they got COVID, so they did not believe they would get sick. If they did have health problems, they were often things like high blood pressure or being overweight that didn't interfere with their lives much. But these conditions increase the risk of getting severe COVID. Unvaccinated COVID patients are younger on average, sometimes in their 20s and 30s. We don't see multiple members of vaccinated families getting admitted, but we sometimes have multiple unvaccinated people from the same family in the hospital at the same time. Unvaccinated people are sick much longer, even if they eventually survive to go home. As of yesterday, we had 30 COVID deaths in 2021. 28 were people who were not vaccinated. 2 were vaccinated people who had serious underlying chronic illness. This matches the results across North Carolina, that an unvaccinated person is 4 times more likely to get sick with COVID than a vaccinated person. But compared to someone else the same age, the unvaccinated person is 15 times more likely to die of COVID than a vaccinated person who is the same age. Like the rest of North Carolina, our hospital resources are stretched very thin. Our dedicated staff keep working, but we have days that no matter how hard we work, there are just too many seriously ill patients. Surgeries for other serious illnesses are having to be postponed because we don't have enough staff to take care of all the COVID patients and still care for all the other problems like strokes and heart attacks that people continue to have, even when you add a pandemic on top. COVID is not like the seasonal flu. The last time that people in Boone experienced an epidemic like this was the 1918 flu epidemic, and very few of us were around to see how bad that was. Most of our unvaccinated patients genuinely had no idea that it was possible for them to get so sick, or that they could be sicker for days, getting gradually more short of breath, before the sickest people require a ventilator to breathe for them. I believe that long time to think about what they're going through is why so many people tell us they wish they'd been vaccinated. It's not like the movies or a video game, where someone gets shot or dies in minutes. This is a hard illness, and if you're sick enough to come into the hospital, it is not quick and painless. Everyone, please wear masks. Despite what some people say on social media, chemists and physicists who study this have proven that they help, even though they're not 100%. If you're not already vaccinated and you are eligible, we urge you to choose to get vaccinated. If you choose not to get vaccinated, please avoid crowds and avoid any indoor space where people outside your household are not wearing masks.